Welcome to This Explainer. Look, if you're a healthcare professional managing urothelial carcinomas, you already know firsthand the daily frustrations of navigating treatment resistance. Today, we're going to objectively analyze the clinical and molecular evidence surrounding OncoTherad, a novel nanobiological immunotherapy. We'll be doing a deep dive, comparing its efficacy, safety profile, and underlying mechanisms directly against the current standard of care, Bacillus calmette-Green, or BCG, specifically for non-muscle invasive bladder cancer. Here is our roadmap for today. We're going to cover the BCG refractory challenge, OncoTherad's mechanism of action, checkpoint and interferon modulation, a direct comparison between OncoTherad and BCG, long-term patient benefits, and finally, emerging nanobiological combinations. Let's get right into it. Section 1. The BCG refractory challenge. As you know, about 70% of bladder cancer occurrences are superficial. We're talking your PTS, PTA, and PT1 tumors. The standard initial playbook here is pretty well established. Transurethral resection, or TUR, followed by intravesical immunotherapy, usually with BCG. The ultimate goal is obviously to prevent progression and keep recurrence at bay. But here's the catch. While BCG does prevent recurrence in up to 67% of cases, its failure rate is a massive clinical hurdle. Without adjuvant therapy, 70% of these tumors just come right back after exclusive 2UR, and 20 to 30% actually progress. This leaves us with an urgent, glaring need for better immunomodulators, especially for that really difficult cohort of patients who become entirely BCG unresponsive. Moving on to Section 2, OncoTherad's mechanism of action. So to understand exactly how OncoTherad, also known as MRB-CFI1, fills this gap, we have to look at what it actually is. It's a completely different class of treatment. We're talking about a nanostructured biological response modifier made up of metallic salts and phosphate associated with a glycosylated protein. Instead of relying on a live attenuated bacteria the way BCG does, OncoTherad is engineered at the nanoscale to trigger a highly specific cascade right within the tumor microenvironment. Let's walk through this biochemical sequence because it's pretty fascinating how it builds into a robust immune response. It kicks off with the phosphorylation of hydroxylated amino acids, specifically tyrosine, threonine, and serine. This precise biochemical action activates the innate immune system via toll-like receptors 2 and 4, and crucially, the TRIF signaling proteins. By hitting these non-canonical pathways, it fires up the interferon signaling pathway. That boosts interferon alpha and gamma, which then heavily recruits and activates T lymphocytes and phagocytic cells. It's essentially a highly targeted wake-up call for the immune system. And this isn't just theory, it was rigorously tested in murine models. Looking at the experimental design here, researchers tracked OncoTherad's administration over a 15-week period. This structured setup allowed them to meticulously monitor tumor progression and vital protein expression across multiple treatment groups, putting it head-to-head against BCG and controls. Section 3. Checkpoint and interferon modulation. Now check out the stark contrast in these numbers. Look at the PD1/PDL1 checkpoint. The cancer baseline shows a massive 62.3% immunoreactivity, which, as we know, allows the tumor to effectively evade the immune system. BCG knocks that down to 41.8%, but OncoTherad, it drastically downregulates it to just 25.2%. We see a similarly dramatic drop in the rank protein, which is heavily linked to tumor progression and invasion. You can visually confirm this downregulation in the immunostaining results across the different groups. The noticeably lighter staining in the OncoTherad group really highlights its role in stopping tumor progression in its tracks. And it's not just dampening PDL1, it also shows a tendency to decrease FOXP3 immunoreactivity. What that means is OncoTherad is preventing immune evasion by holding back regulatory T cells, which frees up your cytotoxic T cells to actually go in and attack the tumor. The Western blot analyses back up those histological findings perfectly. The bands for the OncoTherad group are visibly weaker compared to the really intense expression we see in both the untreated cancer group and the BCG group. So this definitively verifies that the PD1/PDL1 immune checkpoint is being effectively modulated by this nanobiological intervention. Which brings us to Section 4, OncoTherad versus BCG therapy. From a clinical standpoint, managing adverse effects is a daily battle. BCG relies on live attenuated bacteria. Yes, it absolutely stimulates a Th1 response, but it also frequently causes notable systemic toxicity and local irritation. The physiological toll on the patient can be quite high. OncoTherad, on the other hand, is a nanostructured synthetic compound. It achieves durable immune activation precisely through those TLR4 and TRIF non-canonical pathways we talked about, completely bypassing the biological risks of using a live bacterium. The bottom line is a much more tolerable safety profile with significantly lower adverse effects. But of course, a great safety profile doesn't mean much if the treatment doesn't work. Well, in Phase 1 and Phase 2 human trials, specifically looking at BCG refractory patients, which are absolutely the toughest cases, OncoTherad showed a remarkable 80% complete response. We are talking about recurrence-free survival sustained over a 24-month follow-up period. And this beautifully mirrors the preclinical data. In a foundational studies, they observed a staggering 100% tumor regression in the treated murine NMIBC models. This kind of durable immune response vastly outperforms the standard expectations we have for conventional BCG failures. Section 5. Long-term patient benefits. Here's where things get really interesting, beyond just managing the cancer itself. Because OncoTherad dramatically cranks up the interferon signaling pathway, driving up IFN-alpha and IFN-gamma, it does something pretty incredible. Patients get a profound secondary benefit. Their immune defense system becomes highly primed and responsive, capable of intercepting viral infections. The treatment isn't just attacking the tumor, it's fundamentally retraining the patient's innate immune system. We actually saw an unexpected real-world example of this during the height of the COVID-19 pandemic. A 78-year-old male patient with comorbidities participating in the OncoTherad trial for his BCG refractory bladder cancer contracted advanced SARS-CoV-2. Now, despite his high-risk profile, he recovered and was discharged in just 10 days with zero ICU care needed. This protective effect was attributed directly to the robust interferon signaling induced by OncoTherad, which stopped severe disease progression and those dangerous cytokine storms. Finally, Section 6. Emerging nanobiological combinations. Research is actively expanding into synergistic therapies at a rapid pace. For instance, teams are exploring combining intravesical immunotherapy with platelet-rich plasma, or PRP, to really boost cytotoxicity against bladder carcinoma cells. There's also some amazing work with HACPT, those are hyaluronan cisplatin nanoconjugates. These allow for targeted platinum drug delivery without the notorious nephrotoxicity that usually limits its use. Broadly speaking, all of this ties into the concept of trained immunity, or TRIM, to fight off a huge spectrum of pathogens. This quote really hits the nail on the head regarding the ultimate clinical goal. By tapping into nanomedicine, we can precisely control immune responses. We can use nanoparticles to deliver modulators directly into phagocytic myeloid cells. That means we can aggressively ramp up defenses to fight a tumor or a virus, while also having the capability to calm hyperinflammation to prevent organ rejection or cytokine storms. It's all mapped and controlled at the molecular level. Which leaves us with a pretty compelling thought to wrap up this explainer. If we can safely conquer BCG refractory bladder cancer by retraining the immune system through these precise molecular pathways, what other impossible clinical challenges is nanobiology going to solve next? Understanding these mechanisms isn't just theoretical anymore. It's rapidly becoming our new clinical reality. Thank you so much for joining me on this deep dive into the data today.